Hi, welcome to Active Aging. My name is Danielle Procopio, and I'm your host today. And I'm very excited to talk with you a little bit about Vibra. Vibra Hospital is a long-term acute care hospital here in the Mahoning Valley, and we have both of their liaisons with us today. Their clinical liaison, Jessica Kabetso, as well as Holly Herrholtz, who's their community liaison. So thanks, ladies, for coming with us today.
Thank you for having us.
Absolutely. So I know that a lot of us have driven by Vibra on South Avenue, your Mahoning County location, and some of us might know what it is and what it isn't. So can you just tell us a little bit about Vibra and the history of it, and then we can talk a little bit about what you guys do in there.
Jessica has been with us longer, so I'm going to allow her to field that because I think she'd give a more accurate
I think what happens is as soon as you say, oh, we're the building next to the new Rowley Brothers,
yes,
it's like a light bulb goes off.
Absolutely.
A lot of people don't know what we are and what we're about. They do see the sign that it's Vibra Hospital. So basically what we are, we have a 28-bed facility there, all private rooms, and we also have our location in Trumbull County, which is on the 9th floor of Trumbull Memorial Hospital.
Very convenient.
And yes, for both counties. I know people don't like to cross those lines. And what we do, we serve the population of the very critically sick. The patients that are in the hospital and needing more than just either a lower level of care, such as an extended care facility. It's the long-term acute antibiotics, the bad complex wounds, the complex respiratory status. Mm-hmm. So it's a lot of those accidents you hear on the news. We get a lot of those people, the tractor rollovers, the motorcycle accidents, a lot of those, the traumatic brain injuries. So the patients that are, a lot of them do come from downtown, and we continue with that plan of care. So the physicians get the plan of care, they stabilize the patient, they have the plan of care, and then we pick it up and complete it.
Great.
At our facility with our physicians. And it's still daily visits by doctors.
Very good.
So
I know that Holly had told us when we talked a little bit briefly that you have quite a robust physician staff. It sounds like we've got a lot of doctors that are coming in and out there. And I do want to talk a little bit more specifically about what the LTAC or long-term acute care means in the realm of the whole continuum of healthcare. But I want to know, how did Vibra come about to Youngstown? Because Vibra is a national company, correct?
Yes. We used to be known as Mahoning Valley Hospital. It was a freestanding hospital, and it was started by Dr. Politis.
It was Dr. Politis and Mike Sinchek,
yes,
correct?
Mike.
Yes, very good.
I don't know if you remember, I went to the original opening. It's so funny to be there now as an employee because I was there originally when they first opened their doors.
Yeah.
And to see it change and evolve in two different hands is amazing, in good hands at that. Very good hands.
I think they built the reputation.
Yes.
And then there is a single owner, and it struck a chord, and he wanted to purchase Vibra. So this is where we are.
I think he stayed pretty true to the original vision, too.
Mm-hmm. And what is the vision of Vibra?
It is to provide the care for the long-term acute setting. It's for the loved ones that, you can't stay in the hospital forever. At some point, you still need that level of care somewhere else. The whole goal is to get you back to better. That's our motto. That's what we live by. Nobody wants to be in that position, but if you are in the position, it would be our pleasure to be able to help you during that transition.
Sure. And we're very spoiled at this table because all of us have a significant amount of clinical experience. And so a lot of our viewers are not coming from a clinical background. And so I want to make sure that they really understand where Vibra falls in kind of line in their health care. So typically after an illness or an injury, whether it's traumatic or chronic illness, and you go into the hospital, those stays are going to be shorter. So typically people are going to be in that hospital for a short stay, and if the disease process or the injury is something that cannot be resolved in, let's say a week, and I know that's probably roundabout because sometimes it'll be longer, sometimes it'll be shorter. If they need that extended care for that illness or injury, that's kind of where the long-term acute care steps in, correct?
Right.
Absolutely.
Okay. I know we had said when you're not well enough to go home yet, but you're still not well enough to get to like rehabilitation at a skilled nursing facility. So it's that almost in between.
Right, very much so. Or there's something ordered specifically that only we can handle, that's typically handled in an ICU or a CCU setting.
Perfect.
So I always tell families, it's like when you go in and you see all that equipment at the hospital, when you come to our hospital, it's exactly the same. You see all of the same equipment. We are to create the continuity of care.
Perfect.
So we don't miss a beat on what the vision is for the care.
Very good. Did you want to add anything to that?
No, I was just going to elaborate on, we call Vibra is a long-term acute care LTAC, where the hospitals are called STACs, short-term acute care. So it's going from a short-term acute care to a long-term
Perfect,
acute
and we
care. So it
probably
is-
don't think in that
No.
in that
Right.
frame. So I think that helps us to kind
Yeah.
of figure out when it's an appropriate time to be at either space, especially for our viewers that
Right.
might not be as well versed as we are. So what are some of the different diagnoses or different types of cases that you see? Like, what is a patient going to look like that's coming to Vibra?
Pretty complex.
Okay.
There's a lot going on with our patients that we're evaluating on a daily basis. They could be on ventilator support, they could be on machines, and our big goal is to wean that. They could have a breathing tube, and our goal is to get them off of that and to get them breathing on their own. Very aggressive pulmonary rehab we do have. So in our, the respiratory program is very good. We have a respiratory therapist on site 24 hours a day, 7 days a week. The pulmonologists are around every day, working on their ventilator settings and trying to wean them off. So a lot of our patients are the very critical respiratory. But we also see then the bad wounds, the wounds
Absolutely.
that are either non-healing from surgery, post-op complications, needing wound vacs or the apparatus that sort of sucks out the pus, I guess for a better word, needing long-term antibiotics. So if there's antibiotics that need given around the clock and maybe every 6 hours, 2 or 3 different antibiotics on. So we do manage all that.
Very good.
And dialysis too. So we do dialysis in room.
So you're dealing with a lot of different chronic diagnoses there. I know I've heard a lot of great things in the community about your respiratory programs and your ability to wean off of a ventilator. So I'm sure that we have a lot of patients in the area that could benefit from that if they're ever in that situation.
I was speaking with Clarissa, who is the head of our respiratory, and she's very proud of her team, and she's very proud of their ability to have successful rates.
Very good. Very good. So speaking of successful rates and whatnot, are there any quality measures that we should be aware of when we're talking about LTACs? I know that this is a great time to be a healthcare consumer because we're able to find anything out really about the providers that we choose from, and we're able to go to the internet and to CMS and look at star ratings and look at quality measures. And so I think it's great that everything's that transparent. Is there anything that we should know about Vibra and maybe shine a spotlight on as far as your quality measures?
Well, we're not measured the same as skilled nursing facilities. We're not a star rating necessarily, but we do provide our own quality measures, and we actually send them out every quarter that we have them. We are tracking them ourselves in-house and making sure that we're within the parameters of the Medicare guidelines and above what a normal standard would be.
Infectious rate is
Excuse me.
our Foley catheter infectious rate. We're well below national standards with any kind of infection. And we monitor the respiratory, the ventilator wean. So those are our big two that we
Very good.
really follow a lot.
Perfect. And that's why you're out of hospitals, make sure that you're getting good care. And so it's so good to know that you guys are kind of rising above those standards and doing really well. So that's very good to know. Are there any programs other than respiratory, oh my goodness, respiratory, that we want to talk about today? I know we had talked a little bit about the wound care program and some of the specialty wound care projects and abilities that you have.
Well, I know that we're very proud of our wound care. I'll let Jessica, as our clinical, speak a little bit more on it because we do a lot of bedside treatments that most people don't realize that we do in-house. You don't have to leave us to have them done.
Once you come into our facility, we do have a wound care specialist that does see all the patients and does evaluate all the wounds in the wound care. If they have any kind of if they see that, hey, we can do this different, they're going to either contact infectious disease or the wound care clinics that we work very close with in our area. We do have a product called Safe Blood, which is it's amazing. I don't even know how to put it into words. What they do is they take the patient's own blood and they spin it down and they take all the good stuff out of it and they actually put it on the wound base and they cover it up with a protective barrier, and that actually just harvests new blood and new growth and gets that wound really nice and pink and closing. So all of our wound nurses are specialized with that process. It's very nice, and we've seen amazing results with that. It's nice, and we work very closely with all the wound care nurses in all the hospitals, local hospitals.
And I think, I'm sorry,
Oh, no,
Holly,
that's
go
what I
ahead.
was going to say. We are the only ones locally who provide that.
Very cool.
And I think that's important for the public to know is that we do advanced treatments here in the Valley.
Absolutely. And that's available both at the TMH location as well as the South Avenue location,
Yes.
correct? So something that I think is really cool about Safe Blood and something that our audience might not realize is that typically when you're being treated for wounds, we're introducing chemicals or medications. And so with Safe Blood, it sounds like you're actually using the patient's own blood. So therefore, it's going to be way less chance of any type of reaction or irritation. It sounds like it would be a much healthier way to be healing from a wound.
Yes.
Yeah, actually, if you were to speak to Tom, our wound care nurse, he just gushes about it because he's so excited about our outcomes. He said that knock on wood, he's had great outcomes every single time.
How fantastic that is. And typically, do you see a faster heal rate with those as opposed to
Yes.
using like a wound
Oh,
vac or
yes,
something
absolutely.
else?
Yeah.
Yes, it's definitely a preferred method, I think, in a lot of cases.
Very good. Well, I know if you've ever had a wound or you've had a family member with a wound, that process of healing can take a very long time. So to know that there's an option out there that'll speed that up a little bit. And again, this isn't for a simple wound. This is going to be for a very complex wound. So patients would be coming in for this maybe after surgery, or when, Jessica, would there be a patient that would be appropriate for this?
We actually take them from the hospitals. We can also do evaluations at any wound clinic in our area, and we've even been consulted to come out to local extended care facilities.
Oh, wow. Very
Right.
good. So you don't necessarily then have to come to Vibra straight from the hospital. There's opportunities to enter from different points of care.
Right. And
Very good.
we're the only one that does that also.
Right.
That's good to know. That's good.
Which
We
is
need to know that.
important, especially for your non-healing wounds.
Yeah. And they might
Absolutely.
need cultured and start some antibiotics. So we've done that with the facilities. We'll take them, run their cultures, get their blood work, get the antibiotic plan, and if it's something that is cost effective, if it works for everybody, we'll turn them back to the local facility.
Very good. You mentioned antibiotics and culturing. Something that I've learned recently about Vibra that I was really impressed by was your pharmacy staff. So I don't know if you want to talk a little bit about what's happening with you from a pharmacy perspective. If I'm a patient at Vibra, what I have access to.
So we have our own in-house pharmacy. We don't contract out, so they are right there. And we have been very aggressive with getting more acute patients. More acute patients are in the hospital, so we are able to do a lot more of the drips. So we are doing the propofol drips, the cardizem drips, the Presidex. We're doing a lot of the drips, and our nurses are very well trained. So it's exciting.
Very good.
Our pharmacists were very pleased to say that he comes from critical care.
Right.
We have the ability to provide something amazing at our level that typically you would see hospital level.
Correct.
Very cool.
And he's in-house, so you literally will see him in the hall. You'll be able to say hello to Matt and see him and have a conversation with him versus just having medication brought to you and you don't really know who the pharmacist is.
Yeah, that's wonderful to have that type of resource in-house. I know that you have, like, obviously the pharmacist there and a ton of doctors, from what I understand, nurse practitioners that are also on the floor. And I think that might be one of the biggest differences between skilled nursing and the LTAC, because I know we had talked about, how is that different? What is the difference between the skilled nursing and the LTAC? And obviously you're usually caring for a much higher acuity patient than what we have. But from a physician standpoint, tell me, what does that look like day to day? Is there physicians there daily? Do you have a physician around the clock? It's skilled. It's the physicians are visiting as needed and on a scheduled basis, but they're not in the building 24 hours a day.
We have nurse practitioners in our building 24/7 or physician assistants. So anybody that isn't doing well, they're going to be treated right there in our building.
Very good.
And we do try to keep them in our building. We are able to intubate patients, maintain them on ventilator support. We have successfully weaned them. So we do try to do everything we can to keep them in our building. But if needed, we will send them back to their facility, hospital that they were at before. But it is nice. We have the doctors visit daily, nurse practitioners visit daily, and it's just around the clock, 24/7.
Very
Support.
good. Very good. And who are some of the doctors that you are working with?
Well, we work with Dr. Nagy, Dr. Tunisia, and I have to apologize. I'm more familiar with Warren's doctors off the top of my head. We have We also have Dr. George, we have Dr. Sutton. There's so many, like copious amounts. I don't want to leave anyone out. So
Yeah.
That's okay.
I know that you can probably,
Yeah, we have all the local nephrology groups. So I think I hate to say, there's 3 big ones. And we have, all of them are on staff. Most of the podiatry services in our area are credentialed. GI, gastroenterology is consulted. Most of the pulmonary groups also
Wow.
are on staff. So yeah,
So you have access to a lot of different specialists, it
Correct.
sounds like.
absolutely.
that come into our building that they don't have to leave for.
Perfect.
And really what that means to families that I think is important as a person, if I ever had to put a loved one in the care in a situation, is that I know that I have the ability to ascertain so many levels of care in one stop. I don't have to worry about my loved one leaving to have to go get a specialist.
Yeah, that does make a big difference, and it makes it a lot easier on the patient as well as the family.
Absolutely.
Speaking of families, tell me a little bit about satisfaction. Have you had good luck with your patient satisfaction and family satisfaction?
I'd say absolutely. Yeah, we were just recently, Jessica, also my cohort, at a health fair. I think the best thing is when we're out publicly and families come up to us to tell us how wonderful the care was, or it was a former patient coming to thank us to tell us how wonderful their stay was and
Oh,
how
wow.
excited they were to be able to thank us in person on the healthy side of things. That's worth $1 million. No one can ever say that we don't do good work when you see things like that.
Absolutely.
We actually had one of our former patients come to us and say, "What can I do for you? How can I get the word out
Oh,
that I'm
wow.
a success story?" So we have a relationship with YSU. So he was able to walk out to the 50-yard line before one of the YSU games.
Oh,
and
how
that was,
cool
he was
is
so excited. Yeah,
that?
he got a signed ball from Jim Tressel and the YSU football team. So that was really neat that we were able to do that for him.
And how nice for you all and the staff, the floor staff that's taking care of the patients, to see those types of successes. Because people, I imagine, are very sick when they come to you. And I'm sure that, not everyone leaves with the ability to walk out to the 50-yard line. So what a great experience, and how rewarding that must be for you all.
Absolutely.
Very good, very good. So I know you're also very involved in the community. I did see you at the Health Expo that the Chamber held for us last week. So it was good to get to see Vibra out there. And I know that you're trying to do more in the community. So tell me a little bit about where we might see Vibra and why you're so busy in the community.
Well, it'd be my absolute pleasure to explain our theory on that. As the community liaison, our goal is to give back. It's not enough for me to go to a family and ask to take care of somebody. We want to make sure that the community sees us as a partner in the community. And really what that looks like is you're going to see us at all the heart walks. You're going to see us walking for Alzheimer's. You're going to see us at all of the health fairs, the expos. We want to make sure that we're that piece that we can give back to the community as needed. We're also looking at possibly doing our own health fair on site at Boardman.
Oh, wow.
And giving some screenings there in the summertime. And I know our CEO is very passionate about that. And I really think that's an amazing way to give back to the community. It's not so much what it is that we can do for you, but sometimes what we can do for you in the community to give back.
Absolutely, and that's such an important part, that we're all active and trying to support the community and giving back how we can. So it's great to hear that Vibra is already doing that.
Yes, and we're open to any other suggestions. If anyone has any other community things coming up, we would love to be a part of it. We really just want to be that piece where people look at us more than just what we do, but, oh yeah, they're the people that helped us with this.
Excellent. So I know if you guys are like anyone else, you are looking for staff to help you achieve your mission and take care of all of your patients. Is Vibra currently hiring?
Yes, midnights, I know specifically.
So if we have anyone that's
The
looking
best
for a
shift.
very late shift.
Yes, but we also do a lot of PRN work.
Yes, that we. Yes.
Okay.
So what a PRN person, what that looks like is they may go to Warren location or they may go to Boardman. It's more of an as needed, and that really fits in a lot of people's schedules, to be honest with you.
Absolutely. And I imagine that probably would be good for a lot of our viewers, because a lot of our viewers are very accomplished and nurses and other healthcare professionals, and they might be looking for something more PRN as they are starting to look towards retirement. So if there's any viewers that are looking for a position, then hopefully they'll check out your career page and see if there's something that's a good fit.
Right, I strongly encourage it. And if anyone ever just wants to stop in for a tour, please come and check us out. We are a beautiful facility. It would be my pleasure, and Jessica's and anyone else in the building to show them around.
Do we need to make an appointment if we want to come in for a tour?
No.
No.
We're
And the
20
building will sell itself.
Yeah, we're
it's very nice.
24/7.
Someone will be there to give
Yeah,
a tour.
someone's
then.
always there.
Someone's there.
That's the joy of it.
Very good, very good. If we do want to learn a little bit more information about Vibra, or if we want to contact you because maybe we think we're a good patient or a family member might be, how would we go about learning more and doing that?
Well, we do have our Facebook page. You can definitely look us up on our Facebook page. Also, you can contact any of the liaisons by phone. They answer their phones 24/7 as well.
Okay.
So it's very convenient, and we could provide those numbers. There's nothing better than, as a family member, knowing that you can call Jessica if you have a question or if you think that you may be a good fit.
Okay, so is there a website that families might be able to take a look at and see some information?
Yeah, it's I think it's just Vibra.
No, it's Vibra.
Yeah.
It's Mahoney Valley Vibra.
Yeah.
Mhm.
Mahoney Valley
Very
Vibra,
good.
yeah.
Okay, and then is there a phone number that we should give viewers in order to contact?
330-726-5000.
Perfect, and that'll connect us to the South Avenue location,
Correct.
and then you can
Correct.
get transferred to
Yep,
Trumbull if we're
absolutely.
looking for
Yes.
questions about Warren. Very good. So as viewers are maybe asking some questions and wanting to know a little bit more, they'll have the ability to do that. So I know that you had mentioned, Jessica, that you're part of the continuum, that people are usually coming to you and then recovering as they leave. So it sounds like there's a lot of partnerships there that you're working with. So are you seeing that patients are just going home after they leave Vibra? Does that typically happen, or are we looking more for
It does.
extended care? Oh,
It
wow.
does
Okay, I would not have
happen.
expected
So
that answer.
I know, it really does, and it is shocking. When I first came to Vibra, I've been here about 3 years, I did not expect to hear the outcomes, to hear the success stories, but we do. Our average length stay there is about 3, 4, 5 weeks. It
Okay.
can be even longer. So it's sort of what the patient needs. But our average length of stay is about 4 weeks. So in that 4 weeks, we do very aggressive physical therapy too. So we have physical therapy and occupational therapy, speech therapy. So we're hitting every part of that patient that needs addressed is being hit.
So as a patient's healing, then it sounds like we're providing therapy to make sure they're staying strong and
Absolutely.
have the ability to get around safely
Yes.
when the time does come to leave.
Yes, 5 days a week we do
Okay.
provide physical therapy.
Wow.
And we have a dietitian also that is monitoring their oral intake and how well they're eating and any nutritional supplements too. But they do go home. We do a lot with home health care.
I'm sure.
Also to acute rehabs. A lot of the patients, the next step hopefully would be acute rehab or to the subacute unit or units too.
Very good.
Yeah, actually, I would echo that. I was equally as surprised to find out the amount of successful discharges home, but likewise too our skilled facilities in the area, and we're always looking for those vested partners in the area, people of the same goals for people and getting them back to better. We really are looking to partner with those type of companies and those buildings, such as yourselves, that do amazing work and can get people back to where they want to be, home with their loved ones.
Absolutely, because really that is the goal for all of us, is to be able to get people healthy enough so they can return back home. So
Absolutely.
I'm glad that you're there to help everyone get to that point, regardless of what that illness or injury might have been. And it sounds like you can cover a lot of that at Vibra. So we have a couple minutes left before we close, and I just want to know what is coming up in the future for Vibra. Like what's down the pipe? I know that we've got some changes coming. It sounds like in Trumbull County, maybe. Are you able to share any information with our viewers?
I'll let you take that.
Well, we're very excited to say that we are looking at adding beds to the other side of our Warren location. And what that means to the public is that they'll be given private rooms and there'll be more beds available for us to provide care. So when you're looking at that expansion of Warren on the 9th floor, it just creates so much more excitement for us to provide more care. I mean, you can't be, there's nothing more disheartening than when you're looking to place people and you've got all of your beds taken.
Sure.
And you're going over to Boardman when the family really wants to stay in Warren. So we're very excited to have that.
That is very exciting. And when do you expect to have those beds added, or do you have a time frame on
That's
it?
such a
Maybe?
magical question. It is. We're trying to nail down an exact date on that, but we're looking within the next 6 months. I would
the
think
next 6
that's
months.
really an
I would,
educated.
Trumbull has been through a lot of changes and has been
They have
going through
been.
a lot of changes. So I think we're not on the front burner. So, we keep plugging away.
Okay, so hopefully by end of year then, that'll be
yes.
something
Yes,
that's our goal.
exciting
Yeah.
that we can talk about. And I'm hoping that you'll have an open house so our viewers can come and check
Yes.
out.
We absolutely are planning an open house, and then we wouldn't miss it for the world, and we would love everyone to come out and take a look.
Very good. Well, I appreciate both of you being here with us today.
We appreciate you asking us.
Oh my
Thank
gosh,
you.
of course. If you have more questions or you want to learn more about Vibra, please don't hesitate to contact Holly and Jessica and they can answer your questions. We appreciate you guys spending some time with us today and we look forward to seeing you next month. Have a good one.